Hello, hello, hello. It's Dr. Unati. Let me know where you are tuning from. It is a Friday. It is a Friday, 2:15 p.m. and 12:15 p.m. MST. Today it is a unique show. Just by myself. Let me know where you are tuning from. Let me know. And for people that are new to this page, I just want to let you know that I appreciate your coming up here and coming to join our discussions. My name is Dr. 𝐐𝐮𝐞𝐬𝐭𝐢𝐨. I am the medical director and the CEO of this page, Dr. M Health Corner. So today we're going to talk about a topic that I am passionate about this month. Let me know where you're tuning from. Hello, welcome, welcome. Please type in here and let me know if you can hear me. Let me know. Wonderful. Can you hear me? Thank you so much. Thank you so much. So basically, I just want us to talk about breast cancer. Last week, I brought a beautiful panel here, a panel that basically took a deep dive on what breast cancer is, the treatment options, the presentation. But today, I think it's important for us to discuss in depth the symptoms, who is at risk, and when to screen. Hello, hello, hello. I see people are coming on. Thank you so much. Let me know where you are tuning from. Let me know. And to our LinkedIn family, StreamYard doesn't allow us to pull up your comments. So I apologize. I won't be able to pull up your comments. Um, Facebook and YouTube, I can see people are wonderful. Yes, South Africa. There's my sister here. She's in South Africa. Thank you so much, Oda, for tuning in. And also, just let me know if you can hear clearly. I'd appreciate that. For people that are new on the page, just click that subscribe button and the notification so that you don't miss our talks. Our page is just about mental health advocacy and disease prevention. And I bring here wonderful speakers, healthcare leaders, and also our allied healthcare professionals to come and join us, take basically deep dive on their expertise. And this page is just about everything that is evidence based. So thank you so much. Yes, again, today our topic is breast cancer. So, what is breast cancer? Breast cancer, when you look at the statistics globally, our stats, World Health Organization tells us that breast cancer is just one of those leading causes of death in women, and not to uh, underestimate that men are also affected by breast cancer just by 1%, and basically just in the last year, we had over 2.8 million people that were diagnosed with breast cancer, and there were 680,000 deaths. This is a global stats, not from me, from World Health Organization. You can go and check it out. And in the last 5 years alone, people that are living with breast cancer, they are around 7.8 million globally. So who is at risk? So basically, every woman is at risk, really. But there's two major things that we cannot change: our genes. If there's a family history, you are at risk, but it doesn't necessarily mean you will develop breast cancer. So there's that risk for you. And aging, as we age, our cells degenerate, and older cells could develop into cancer. Not necessarily just breast cancer, you are at risk of other cancers like colon cancer, for instance. And then, what are the other things that you could do to reduce the chances of activating these possibilities? You know what? The use, okay, the living healthy, choosing right for yourself. And as you know, people that are familiar with this page, we talk about healthy living, living healthy, the healthy weight. When you look at the stats globally, obesity is just one of those causes, or probably the common factor in many diseases. You look at diabetes, you look at cancers in general, diabetes, obesity has a higher risk of developing other illnesses, like, of course, the cancer. So, obesity is a high risk. And of course, if you are sedentary, so many people live or probably work in offices. They don't necessarily, they're not active, they basically take lifts and they drive to work. So people that are not active, they run a risk of developing breast cancer because it's easy to gain that weight. And if you're not eating lots of vegetables, fruits and vegetables, you are at risk. And people that are exposed to radiation, I know a lot of times people, this one you need to actually take note of it. A lot of times people, when they are ill, say you are coughing, you go to your doctor or your nurse, doc, I think I have pneumonia. And your doctor tries to convince you that no, most likely it's just a mild chest infection, and you insist you want that chest x-ray. Or sometimes you insist even on your children to get that chest x-ray. So I always tell my patients, by the time you are 30 or 40, how many chest x-rays would you have had at that time? So the exposure to unnecessary radiation is also one of the risks of breast cancer. So be careful when you ask for those x-rays. And colleagues that are here, I also want to also emphasize to us, let's stand on what we believe and also what we've learned at med school or in our training, in our residencies. We all know this. Not every chest infection needs imaging. So that's important to take that time and educate your patients, right? So that's another risk. And people actually who are at risk, it's people that delay, pregnancies, because you are exposed to progesterone, to estrogen. So studies show that women that have kids below, when maybe they are below 30, they are at a better chance of basically having a reduction in risk of breast cancer. So waiting late, and here's the part that is tricky because women now are waiting a little bit late, they are career driven, people are starting late to have kids, but that could put you at risk of breast cancer. And people actually who get into menopause late, because remember, menopause depends on estrogen. All right. So as you have this circulating estrogen in your body, this could predispose you to breast cancer. And people actually who stay long on oral birth control, any birth control pills that are high in estrogen, they could actually predispose you to breast cancer. All right. And of course, I mentioned the genetic component. If you have family history, I come from a Black community, obviously. I know that growing up, a lot of people don't know their history. So it's just about time people ask those family histories. Or if people don't know, because your aunts or your grandparents don't even know they ever had breast cancer, or some of them died of other causes, not knowing they had. So it is your responsibility. Now that we come in front of your screens and talk about these issues, go for screening. All right. So it's very important for you to go for screening because a lot of times people don't know their family history. All right. Uh, yes, I can see Wiseman has joined us. Thank you so much, Budi. People are coming all the way from Dubai area. South Africa is presented. Thank you so much. And we talked about the weight basically as people are coming on. Thank you so much. Living an unhealthy lifestyle could predispose you to breast cancer. All right. And how is the presentation? If you look back, I posted here a really nice picture from the medical news today, a reliable source, showing you how breast cancer presents. First of all, first things first, make it your habit to do breast exam monthly. Make it a habit. When you are taking last week, I brought Dr. Freehill here. She's an orthopedic surgeon. When you are an orthopedic surgeon or you're a surgeon, you basically you focus on your orthopedic stuff that you do. But this lady decided to make it her habit. She was taking her shower and boom, she found a lump on her breast. So let's make it a habit to examine our breasts. Okay. And some people are lucky, it's usually the partner, the spouse that finds these lumps. All right. So it's not a difficult task to do so. I'm going to try to show you how to do that. So basically, what you can do, you stand in front of your mirror, and just for you to know, breasts are usually not the same in size, so don't panic. The key thing is, what are you looking for when you're going to check for this? You're looking for a lump. A lump from breast cancer sometimes is just hard and painless. There's no pain. But that doesn't rule out breast cancer. Sometimes they are tender, these lumps, they are painful basically. And sometimes, as I said, with your examination, you might miss these breast lumps. So what you can do screening. I'm going to talk about that shortly. Okay. So you find this lump and then you find your breast. It looks like an orange peel. An orange peel. It's thick when you look at it, and there's dimpling. When you look compared to the other side, your breast has dimples. Or when you look at your nipple, it's retracted. It's kind of like it's gone inside when you compare it to the other side. So that could be a red flag. Okay. And when you look at your breast nipples, you find that there's some discharge coming out. Sometimes it has blood. Sometimes it is just yellowish or whitish stuff. Anything, if you know that you're not breastfeeding, there shouldn't be anything coming out of your breast. So look for those red flags. So those are the key things. There's a lump, and sometimes you can feel glands. When you look at your armpit, you feel there's glands there, or probably right in your collarbone, you could have glands, and sometimes right above that, you could have glands. So make it a habit. Examine yourself. A lot of times people, they come to us because they found a lump. So when we're in a shower, be like my colleague last week, examine your breasts. Okay. And of course, men too, more especially if you know that your way to a biggish, you are at high risk, and the risk is the same. Basically, if there's a family history, or there's basically some cancers, they are genetic. One of the famous people that you might know, Angelina Jolie, she even removed both breasts. She decided to remove both breasts because she had a very strong family history, right? The BRCA, we call them BRCA genes. So there's one and type 2. So she removed her both breasts to reduce her chances of recurrence. Okay. So men, examine your nipples, examine your breasts too, because you could have breast cancer. Like I said in the beginning, there's 1% of men that develop breast cancer. Okay. So yes, so that's a presentation of breast cancer. You need to examine your breasts, and don't stay too long on birth control pills. I know that women are taking long now to have kids, but weigh your options. Discuss these options with your family doctor. And also, if you are on menopause, ideally it starts between 45 to 55, but some women are still having their periods even at 50, at 53. So that's kind of like a late menopause. You are at risk of breast cancer. Okay, so it's important for you to make sure that you do those physical examination. What is a physical examination? Every year to every 3 years, depending on your risk, you go to your doctor or your nurse practitioner or your nurse. In the case of South Africa, where the clinics are run by nurses, check head to toe examination. All right, head to toe examination. An exam without a breast exam, and also pap smear in a woman who's sexually active, specifically for the pap smear piece, is incomplete. All right, so you need to do your examination. Make it a habit. Examine your breast every month. All right, if you find any lump, there's a lot of fear when people find lumps. My culture specifically, when I was practicing in South Africa, a lot of times when we saw elderly people, they didn't want to talk about it to their families. There's a lot of shame, there's a lot of guilt. Please, guys, go and screen. Anyone could have cancer. It doesn't choose. It could be anyone from any race, from any socioeconomic status. Do not delay treatment. Nowadays, breast cancer is treatable. Like I said, in the last year alone, the stats shows us 7.8 million people are living with breast cancer, or they are survivors actually of breast cancer. So they are on remission. They were treated completely. So it's up to you to do what you need to do. Examine yourself, eat a healthy lead a healthy lifestyle, reduce the amount of stress. People underestimate what stress does to the body. Stress changes our cells, and when you have oxidative stress, when you are in that continuous survival mode, that could change how your cells function in your body, and even other forms of basically cancer, not necessarily breast cancer. So it's important to reduce your stress levels. It's important to do those meditations. It's important to do the yogas, the exercise, and be positive, be forgiving. There's little things like that. If you're a jealous person, you're depressed from being jealous of other people. You are a very angry person. Guys, if you're an unhappy person, you have a high risk of developing many diseases, in fact, actually, heart diseases, cancers, and just being dissatisfied with life in general. Your outlook in life is negative. So always look at your life and be in competition with your own self, not with the next person next to you. All right. So treatment, or sorry, screening. How do we screen? Now you find this lump, you come to me, doc. I saw this lump on my breast. So we do not delay. Every woman, I want you to listen to this. Every woman who is 40 and above, you should start screening. You should go for mammogram. And I know that each country is different, and depending if you have medical insurance, like a private insurance, but at age of 40, or at least if you want to delay it, at least 45 and above, you should start screening your mammogram. You should be doing mammograms. And I know that people always say, doc, it's painful, but would you rather live here if you have children and be here and have your kids have their mother alive than being away or gone because you did not screen for breast cancer? So basically, 40 and above, you need to start screening for breast cancer. Some people, they need to start screening early because remember I said in the beginning, there's family history in breast cancer. So if, say, your aunt or your mom had breast cancer when she was 45, in your 30s, you should start screening. Around 35, you should be screening. We always say as a protocol, if your family member had breast cancer at 55, you should start at 45 screening, like 10 years younger than that age. Is it clear? So I hope so. So basically, start screening, do your mammogram, and we look at basically the radiologists, they look at the texture of your breast. If your breast is thick and probably has a lot of fat tissue, those fat tissues could actually have potential sometimes of developing into breast cancer. So we always couple that with an ultrasound. All right, we couple it with an ultrasound to look at your breast, and if there's a suspicious mass, and of course in the case of you found it, we do not delay diagnosis. So we send you straight for biopsy. We need to take a piece of that mass or that lump to see what it is, so that we can see what type of breast cancer. I don't want to get into the types of breast cancer. That one is something you can discuss with the report when it comes. And also basically the risk, breast cancer could spread to the nearest parts, basically your chest wall, your armpits, right? Sometimes to the liver, distant areas. So some people, they have stage 2, or even to the lungs, but it depends when it's caught and what we can do about it. So don't ever be fearful. If you found a lump, don't think that it's going to go away. You wait for another month or 3 and you are scared to discuss it with your family, and have that support system. Last week, my colleagues emphasized support. You need to have that trusted member who's going to hold your hand as you go through treatments. All right. Cancer treatment is a very long, tiring, it's a very exhausting process for those that would have breast cancer. It's a very long, tiring process. You need someone who's going to hold your hand, because you could also get depressed from all of this, and also for the fear of the unknown. You don't know if you're going to survive. You don't know who's going to look after your children. And this is another topic which I'm going to bring again, colleagues that are well advanced or vested in this discussion of wills. What if you are end stage? What's going to happen to your children? These are realities, guys. People, they have these experiences, and we need to discuss them. As uncomfortable as these discussions are, people need to have wills. Here in Canada, I heard that it's only 30% of people that have wills, and I'm pretty sure it's no different from my country, South Africa. So people need to have wills, so that if anything happens to you, your children need not grieve twice: the loss of their mother and the loss of what's going to happen to them when you know more. The reality is, people have families that sometimes dishonesty kicks in, and your monies, your estate is misused, and your children suffer, and yet there was money. So these are discussions. I like discussions. They're uncomfortable, but it's something that we discuss also when we have a diagnosis for our patients. What would you like to do now? We have this diagnosis. What is your next plan? And like I said, breast cancer is treatable depending on your stage. So screening, early screening, guys. All right. And treatment, it depends on the stage. Last week you had, there's chemotherapy, there's radiation, there's also surgery. They basically check all these things and stage you and see where you're at, right? Also in the screening part, sometimes mammogram they could miss the diagnosis of breast cancer. If you have a breast tissue that is very thick, we do send our patients for MRI, the MRI imaging where they could check your breast, because we've seen some people getting missed, but it's a very small percentage getting missed on mammogram and then becoming positive on MRI. So three things: we do mammogram, we do ultrasounds, which is usually coupled with your mammogram, and then your MRI. Not everyone goes under MRI investigations. Usually people we can tell just by doing the mammogram. So screening, screening, screening. Know your family history. Ask your grandparents. Ask your family. Basically, we've seen in practice. We even see people who are not talking to each other. The families that are not talking to each other and refuse to share this history with their siblings because they are not talking to each other, which is risky for you who is not screening. So sometimes your sister could just withhold that information that she has breast cancer, which puts you at high risk. So that's why I said you need to be a very peaceful person, get along with people, be at peace, be loving, right? So that you don't miss things that could be screened and also be screened on time and be saved. All right. Breast cancer is treatable, guys. Screening, screening, screening is important. Men, last week, one of the colleagues here, she mentioned something powerful that for men, it usually brings a lot of shame because we send them to clinics for mammogram where it's all everywhere, it's pink. Men, they get sometimes threatened by these colors. So maybe indeed healthcare, we need to start bringing gender neutral investigation, sites where men will go so that they don't feel out when they go there. Because yes, I said 1% of men will have breast cancer. Like there's that risk of 1%. So we need to create the spaces to be gender neutral so that men don't feel left out or they don't feel like they're out of place when they come. So indeed, live your life healthily, choose a healthy lifestyle, choose your weight. You should have a healthy weight. And of course, now there's medication for obesity. Obesity now is a disease because it is a common factor for many diseases, for cancers, for diabetes, for high blood pressure, for sleep apnea. So we do treat obesity. So talk to your doctor. Each country has medication now for obesity. We shouldn't be seeing many obese people. Nowadays, we see even young people as young as 18, 19 with diabetes type 2, something unheard of in the past. But people, because of the way people eat, there's a lot of eating out, there's a lot of eating fries, there's a lot of eating processed foods. So these foods are not good for our bodies. All right, you guys, the more we eat greens, the more we eat fruits, fresh fruits and vegetables, managing our stresses, having good weight for our body mass indexes. So, indices, it's just the way of life, choosing the right things for yourself and then screening, right? And following up. We have people that come for screening, they never come back. They never come back for following. And also, people like it could affect your mental health. You need your support. And as you go through chemotherapy and radiation, thank God, oncology clinics, they have these beautiful teams where there's a social worker, there's a psychologist who would help you with these questions whenever you have. And chemotherapy can be very debilitating itself. You could get tired. So support, support, support. If you have a friend or you are that friend, you are a sister, you are a colleague, you could offer that support. It is appreciated because people with cancer, they lose hope a lot of times. They have no hope. They are scared of dying. So they really need someone to hold their hands. Okay. As we close, I hope everyone here will do what I asked or suggested that, when you're on your shower, stand there and examine your breast. Like I said, when you stand in front of your mirror, you can hold your hand, right? Like I'm doing here. And you start going around your breast, right? The whole breast, okay? You come closer to the nipple side and you can also feel your axilla. You feel your armpits and you feel also just above your collarbone and just below the collarbone. And also you could even go to your neck area. There's actually glands there that could enlarge, but mostly breast cancer goes to your armpits. So make it a habit every month. check your breasts. And if you see a lump, do not delay diagnosis, because breast cancer grows fast, and yes, go see your doctor, and so that everything goes fast. With the COVID now, I don't know how other countries are doing. Sometimes there's because there's so many backlogged right now, there's lots of people that are canceled for surgeries, but cancer is always prioritized, right? And of course, last week we talked about, now you have removed the breast. How does it affect you? How does it affect your partner? How does your partner make you feel? Right? So these are the discussions we start talking about. If you're a partner here, you have your spouse, your partner, your basically your woman, your wife has breast cancer, be that support. The last thing she wants to hear is you diminishing her self-esteem or putting pressure on her to go for reconstruction. Reconstruction comes later, and people need time to discuss, or maybe to actually look at the options. All they need is your support, your emotional support. That's the best thing you can ever give any person. So do not put pressure on your spouse who's going through breast cancer. There's also hair loss that takes a lot of self-esteem from women, when you're going through chemotherapy, radiotherapy. So people start wearing wigs. Do not mock people who are going through cancer, because there's so much that is involved. And people, their hair is their sense of identity. So if you all of a sudden lose your hair, that's who you are. So we need to be careful. Also, the things we say to people, the questions that, what's wrong with you? What happened to you? Why have you lost weight? Some people, they are not sensitive when they ask these questions. Be careful. You don't know what people are going through in life. Be sensitive and be loving, you guys. And thank you so much for watching. I see people are joining us still here. Thank you so much. And you guys take care. Next week, we're going to come back with another topic. I bring all these colleagues here to come teach us about stuff that we need to be proactive and do. Nowadays, people are living longer because there's so much free information. So we shouldn't say we didn't know, more especially when there's stuff like this. Every week we come here in front of you and talk about these issues, act on them, and do and choose the best for you and your family. All right, you guys, thank you so much for watching. God bless. Okay.